Acute myocardial infarction. Hello, you know what it is. Acute myocardial infarction. Popularly known as a heart attack, acute myocardial infarction can arrive suddenly and lead the patient to death. It happens when there is an obstruction of one of the coronary arteries that supply the heart. The mechanism of this obstruction is the formation of a plaque called atheroma, which is made up of fat. When this obstruction reaches a critical level, or when it breaks spontaneously, altering local coagulation, forming a clot that closes the artery and reduces blood circulation. Due to these blockages in the coronary arteries, the blood flow ends up being blocked for a prolonged period of time, which causes the heart muscle, one of the most important muscles in the human body. See infographic, to be without oxygen and heart cells start to die. Depending on the duration of the acute myocardial infarction and the importance of the compromised artery, the lack of oxygenation of the organ can completely compromise its functioning or even cause it to stop working. According to the specialist, a strong chest pain, of sudden onset, constricting, which resembles a squeeze, can be a sign of a heart attack. Pain that radiates to the left arm or even the chin, accompanied by malaise. Sweating or dizziness are also symptoms of acute myocardial infarction and need to be evaluated by a doctor. However, the infarction can happen even without the presence of severe pain, or with pain that can be located outside the chest. There are people with decreased pain sensitivity who may not feel anything. It is the so-called silent infarction, sometimes more difficult to diagnose. The best-known example of a patient suffering from this type of heart attack is the diabetic, who may have heart attacks that do not follow the common pattern and pain does not exist. Fortunately, these conditions are not so frequent, completes the cardiologist. However, although the most common manifestation is a severe pain in the chest, which is difficult to forget, those who already have a heart and coronary problem and already live with a certain deficiency in the heart may have a milder pain or confuse it with other diseases, such as a pain caused in the spine, in the space between the ribs, muscle pain, something abdominal, or some esophageal problem. Therefore, whenever there is any different discomfort, and a suspicion of a heart attack, the person should be taken to an emergency care service. Exams are essential for correct diagnoses and early care, which increase the possibility of reversing the picture of a heart attack, clarifies cardiologists. In addition to medical monitoring, see how to avoid a heart attack. 1. Control hypertension. 2. Control diabetes. 3. Control cholesterol levels. 4. Avoid exaggeration of alcoholic beverages. 5. Avoid stress. Maintain a balanced diet. 6. Maintain your ideal body weight. 7. Do not smoke. 8. Practice physical activity regularly. 9. Go to the doctor regularly and alert him if there are cases of these attacks in the family. Remember to subscribe. And until the next video. Thank you very much.